It's the precision that you could have with the technology without breaking the skin, and it was all image guided. So curiosity took over, and once I started digging the technology, I understood why people were excited about it.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Dave Hendrick. On today's episode, we speak with Dr. Nikolaos Dervisis, a veterinary oncologist at Purdue University and the Focused Ultrasound Foundation's senior advisor for Veterinary Initiatives, to explore how naturally occurring cancers in animals are helping focused ultrasound researchers answer questions that could help shape the future of cancer treatment across species. Dr. Dervisis shares updates on 2 new clinical trials involving dogs with osteosarcoma and lymphoma, and discusses focused ultrasound's role in destroying tumors and activating the immune system against cancer elsewhere in the body. We also explore the promise of the one medicine concept, the barriers to making focused ultrasound more widely available in veterinary care, and what Dr. Dervisis has learned from the animals and families who make this research possible. Dr. Nikolaos Dervisis, welcome to the Curing with Sound podcast. Thank you so much for joining us today.
Thank you for having me. It's a real pleasure.
Just to start, could you tell us a bit about your background and your path into veterinary medicine?
Sure. I actually found my way into veterinary medicine partially by accident and partially because I was always fascinated by biology in animals. During the vet school, oncology became the field that captured my attention. I liked the biology behind cancer, and what drew me really in was that there were a lot of unanswered questions. So it was a specialty that I felt there was a lot to discover. At that time, late 1990s in Europe, there were no training programs to doing a residency in medical oncology in veterinary medicine. And I was fortunate to find the training position in the States, and pretty much that changed and saved the rest of my career. Early on during my training, I had what I would describe an aha moment. I realized that dogs and cats with cancer were not just pets with cancer. They develop cancer in a way that resembles human disease, not only genetically, but also biologically, clinically, what I could see in front of me, and also immunologically. And that introduced me to the concept of comparative oncology. And that really has guided my career ever since.
And I think all of that ties back to the idea of one medicine and the Focused Ultrasound Foundation's idea that improving the lives of animals through focused ultrasound can also inform better treatment for humans. Nick, how does focused ultrasound ultimately get on your radar?
It's actually a fun story because it happened by coincidence. I had already started working with a different type of tumor ablation technologies, and I was thinking a lot on how to treat tumors outside of conventional modalities. And in parallel, I got contacted by a group at Children's National Hospital in DC, and separately through my department chair at the time, the Focused Ultrasound Foundation. And what actually got things moving was a visit to Children's National, and then followed by a phone call with Neil Cassell, the foundation's chairman. To be honest, I knew very little about the technology going to that call, but curiosity took over, and once I started digging the technology, I understood why people were excited about it. I essentially understood that it was more of a platform rather than a single modality, and for me, that changed things a lot.
Wow, your curiosity kicked in, it sounds like.
Absolutely.
What do you remember about that initial phone call with Dr. Cassell?
Well, the first thing, it was that it's the precision that you could have with the technology without breaking the skin, and it was all image guided, so could actually target what you wanted to kill, avoid damage to healthy tissues, and then the whole field that was wide open from where it could be applied. So the realization that it was a platform that can be used for many things, and curiosity is, for me, as a medical oncologist, really took over. I never get to play with devices until then, and that was like, this could be fun and actually use it to answer questions that I had and I had no way of answering them.
In 2023, you joined the foundation as Senior Advisor for Veterinary Initiatives. What does that role involve, and why is it an important part of the foundation's mission?
Well, I think, in my opinion, when the foundation created this role, I saw it as an acknowledgement that veterinary medicine isn't just a place to test focused ultrasound before it reaches people, but also a genuine partner in developing the technology itself. So in practice, how the work that I've been doing with focused ultrasound, I can say that it could provide input in the foundation's research, veterinary clinical trials specifically, helping through design, feasibility, questions that can be answered realistically in owned dogs and cats. I also help guide the broader strategy on how focused ultrasound can advance in veterinary use, opportunities that might be there, where gaps are, and also building awareness of the technology among veterinarians, which I think is foundational. A lot of veterinary clinicians still haven't heard of focused ultrasound or think it as an experimental way, and that's not quite accurate. I think the awareness for me is a very, very important part. I want to make sure that the next generation of veterinarians come out knowing that this can be a real tool in their arsenal to fight not only cancer, but other diseases.
What makes Purdue such a unique place to advance focused ultrasound research in veterinary oncology?
Yep. So absolutely. And by coming to Purdue, I became part of their oncology team, and like Purdue has one of the oldest veterinary oncology programs in the country. And so the main reason choosing Purdue was their culture. From the beginning, I felt that people here were genuinely enjoying working across disciplines. And I think that's really important for a field like focused ultrasound. I don't think a single discipline can move this technology forward by itself. It takes a combination of cross-discipline expertise to develop new technologies and translate them into clinic and patient care. I am very excited about how we work. So oncology at Purdue is a little bit different. So we're working under the Whirling Comparative Cancer Center. So that's a cancer center in the vet school that the oncology service works through, and the research is happening. Every patient comes first, but every patient also helps us learn something. Faculty, resident, everybody are part of that process. In fact, our research meetings begin with our veterinary nurses updating the team on the clinical trials they're coordinating. That's how they start. And everybody has a voice. Everybody's expertise is valued, and we have a common goal, ending cancer. In addition, Purdue is home of one of only 8 NCI-designated basic cancer research centers, and we're only one of the 2 that have a vet school associated with it. So we're all members of that cancer center. So we're embedded, like veterinary medicine, veterinary oncology is embedded in cancer research. And we're all members of it. We have access to drugs that are being in development for use in humans, and frequently we're pipelining them through animals with cancer. And now having directed energy approaches like focused ultrasound, we can actually do the combinations much easier and much faster than other places. So that's really special, I think.
It sounds like you're in the right place.
I definitely think so.
Excellent. So I believe that you and your colleagues at Purdue, which is one of the country's leading veterinary oncology centers, recently initiated 2 clinical trials for canines, one for osteosarcoma and one for lymphoma. Can you tell us about each of them?
Yes. So I like to see these 2 trials as complementary, although they are asking pretty different questions to start with. So the osteosarcoma trial, though, that's primary bone cancer for dogs. I ran with my colleagues, Mike Childress, fellow oncologist, and Stans, who's a medical physicist. So in that trial, HIFU treats the primary bone tumor before the leg is amputated through surgery, which is a standard of care in dogs. So the dog gets a day of focused ultrasound treatment, and about a week later goes to surgery as planned. And what we're really asking is, does treating the tumor change the biology? And does it change the biology that might help the dog afterwards?
Okay.
And we're using some fairly advanced imaging. So we're doing dynamic contrast CT, NMR spectroscopy before and after the HIFU treatment to actually watch what the tumor does in that window between HIFU and surgery, and not just whether we killed it or not. The lymphoma trial, same colleague, different kind of questions. So lymphoma is a disseminated disease from the get-go. So in there, we treat one of the enlarged lymph nodes with HIFU, and then the dog goes on a full standard course of CHOP chemotherapy. Same thing that they would get anyway if they were not participating on the trial. And what we're testing is whether deploying HIFU in one lymph node does something beyond the local site. Does it raises enough of the tumor own signals to wake up the immune system against the cancer? So the commonality between the trials, other than the HIFU, is all dogs get standard of care along with experimental treatment. So they don't lose, and hopefully they have something to gain, and they absolutely help us to understand what happens to the tumor after the treatment.
I'm sure it's premature to ask this, but I'll do it anyway. Can you share how things are going?
So it's premature to know results. We open the trials the beginning of 2026. So we have treated a few dogs in the osteosarcoma and a couple in the lymphoma. The second one we treated this week. So far the treatment's well as planned. We didn't run into any specific troubles, and the dogs are receiving their chemotherapy. The dog that received the treatment on Monday, we're starting chemotherapy this coming Monday in a few days.
Excellent. You probably speak to a lot of younger people, a lot of doctoral students. Do you advise them to consider focused ultrasound in their research?
I do, and with a caveat, with an asterisk, because I think it's important to be honest about it. So at least from my perspective, I don't encourage every student to chase focused ultrasound specifically. I encourage them to follow the question they're genuinely curious about, and then show them how focused ultrasound is one of the places that the question can live, the research question can live. The field is still young enough that you don't need to be an acoustics expert. You don't need to be an engineer to contribute, especially where I see a lot of the growth is in immunology, on imaging, clinical trial design. You have to use all designs used for chemotherapy or targeted therapies or even devices do not really fit the biology behind focused ultrasound. So there is room on many areas, and the downside of being a young field is, it's really exciting, but the infrastructure is not fully there.
Sure.
Funding is not as widespread as for other areas. It's very competitive. There are a lot of centers. There are not a lot of centers doing this work yet, so it's still a small group. And hopefully I'm contributing, enlarging it. And so that part of the research is building the field as long as working within the field. So I'm being upfront of that, and I think it's exciting. We had our first PhD student here at Purdue came to us actually specifically asking for focused ultrasound research.
Oh, wow.
So that has been a very exciting start. And if a student comes to me with their curiosity, like the one that I had after talking to Neil Cassell for the first time, I tell them there's no better time to get in. The questions are open, which is rare in science, and big impact can happen now. That's the time.
Sure. Is there a patient or a case that resonates with you as to why this work matters?
Yes, there's more than one, but if I have to pick one, it would be my patient number one in my tumor ablation career. So, and I can't say the name because it has been published in press. So this is a Labradoodle named Grayton. So Grayton had an aggressive tumor, stopped responding to standard of care, and we attempted an experimental ablation, and it was the first patient that I ever done this. So it went well for the dog. It worked. Essentially, Grayton succumbed to a different type of cancer, but lived well for a significant amount of time afterwards and symptom-free. But what stayed with me, it wasn't just the medicine, it was his family. So his family actually established a memorial fund in his name, and his family are scientists working at the same neighborhood that I was working back then. And that fund has gone to support multiple published research ever since, including some of the Focused Ultrasound work that we have done. I still have his picture in my office and multiple pictures of Grayton in my phone. So it's we're not treating cases. It helps me. Grayton reminds me that we're treating family members, and many times this is his impact was to show that this can be the answer to many of the barriers that we see that we have to deal with in employing focused ultrasound, because philanthropy like theirs essentially closes the gap that exists for funding this early type of research.
Right. I can only imagine that is a wonderful feeling to see the technology work and so clearly improve the life of this pet and his owners.
Yeah, absolutely. It's great when it works. Absolutely. And I think the important thing, and one of the things that I learned in my PhD from my mentor, is don't forget what we learned from when the experiments or the treatments don't work. Because I believe we learn more than that. If something works, nobody goes and questions it that much as when something doesn't work, and overcoming this disappointment that it didn't work and finding out what failed, why it failed, that provides a lot of information. So it's as a medical oncologist that treating curable cancer.
Yes.
So the vast majority of the times means like nothing works definitively, but learning from the failure is very, very important, to go back and talk to the engineers, to talk to the basic scientists, to the medical physicists, and say like, okay, here's where the failure was. Let's fix it and try again.
Right. I know this is not a question with a simple answer, but what are the barriers preventing these treatments from being more widely available for pet owners?
So there are a number. I think the real barriers that we're facing now are not scientific in veterinary medicine. They're infrastructure. So it's access to devices, and devices that are made for veterinary medicine. Right now, there isn't any. At least there isn't any that you can get your hands on easily. Another big barrier is cost of getting devices, the current devices. If you go experimental, there's an undetermined amount that you need to spend. If you use human devices like the one that we use through the generosity of the foundation here for our HIFU studies, is made for humans, which makes it much easier to use, but still it's not, it doesn't correctly fit in the veterinary workflow. Another big barrier is awareness.
Sure.
Plenty of veterinarians and owners still don't know that focused ultrasound exists, or if they know that they exist, they have no idea even what it looks like, what the device looks like, what can you do with it. So I think solving these infrastructure type of issues would be the first step to allow for this technology to be more democratized, be available to people outside of academia to use.
Well, if we look ahead, if we're 5 or 10 years in the future, where do you think we are and what are you excited about?
What excites me, what I would love to be able to do in this timeline is move from simply ablating tumors to closer to something like precisely programming a biological response with our treatment from the tumors. Essentially, use the treatment to destroy cancerous tissue, but in a way that we can direct the immune response to it or the body's response to that distraction, so that we can rid of the body, whether it's a dog or a cat or a human, can rid of any metastatic disease, any cancer cells that have spread and evaded our targeted treatment. And that means more improved treatment planning, improved image guidance, specifically for veterinary medicine patients, which come on all sizes and shapes. Probably AI-assisted delivery, although I don't mean AI like it's becoming a buzzword, more of a actual technology-based, and then combinations with immunotherapy, and most importantly, having a way to tell in real time whether the treatment is working versus waiting weeks or months to see if the tumor shrank, which is what happens also in people today. Like, there's no good way to tell, like, did the treatment work, or other than just wait and see.
Are you optimistic?
Well, I'm an optimistic person because I treat incurable cancer. But I am optimistic because I think there is a wave of positive outcomes and positivity in general. And I think the technology is mature enough now that it's an easier hurdle to go over, to put it in, to make a device that is veterinary use friendly. It's not a small thing. It will take a lot of work, but technology makes the technology advances now are such that I think devices specifically developed for veterinary medicine are more feasible and not a pie in the sky kind of thing.
Okay. Do you have pets of your own?
Yes, I do. Right now, our family has 3 cats. 2 of them, Orion and Toothless, are 11-year-old litter mates, been since us with babies. Fun enough, Orion has less teeth than Toothless. Toothless is named after the dragon. And yesterday, we adopted a new kitten who's still settling with her family. The funny part is that the new kitten doesn't have a name yet. He's actually my youngest daughter's kitten. So we're all working through what has become a surprisingly long list of names.
Well, is there anything else that you would like to add before we say goodbye?
I think I would like to end just by saying thank you. Thank you to you and hosting me. I've been a listener from practically all the episodes this far of this podcast. I would like to thank the work of a lot of people. Like, I wouldn't be here without my collaborators, faculty, staff, residents, nurses, techs, and graduate students. I'm especially thankful to the veterinarians who trust us with their patients and refer cases to us, and the families that choose to enroll their animals to our trials. That's an extraordinary gift, and we never take their trust for granted. And finally, I would recognize the philanthropy that makes everything possible, the philanthropy that supports the Focused Ultrasound Foundation, and the incredible support of the Whirling family that supports our Whirling Center here at Purdue.
Fantastic. Your work is a great example of how focused ultrasound research crosses traditional boundaries, bringing together veterinarians, physicians, engineers, and people from a range of disciplines to improve the lives of both animals and people. Thank you so much for joining us on the Curing with Sound podcast.
Well, thank you for having me, and I'm really excited to be part of the family.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at FUSFoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on Focused Ultrasound. We would also be grateful if you would rate and review the show.